If your doctor has recommended a pelvic ultrasound, you might be wondering, what exactly happens? Does it hurt? What should I wear? And how can I feel more comfortable? Today, we'll break it all down, simply, step by step, so you know exactly what to expect and how to prepare. Hi, and welcome to Clarivive MedInsight, where women's health is explained clearly, confidently, and compassionately. Let's start with the basics. A pelvic ultrasound is a safe, non-invasive scan that uses sound waves to create images of the organs inside your pelvis, like the uterus, ovaries, cervix, bladder, and sometimes the fallopian tubes. It's often used to investigate issues like irregular periods, pelvic pain, PCOS, fibroids, cysts, infertility, or early pregnancy. There are two main types: transabdominal, done over your lower belly; transvaginal, done with a small probe inserted into the vagina, more detailed. Both are safe, and your doctor will decide which one or both is best for your situation. How to prepare for a transabdominal ultrasound. This type is done externally, with a probe moving over your lower abdomen. You'll likely be asked to arrive with a full bladder. Yep, full. Why? A full bladder helps push the intestines out of the way and gives a clearer view of the reproductive organs. How to prep. Drink 24-32 O's, about 1 liter of water 1 hour before the scan. Avoid emptying your bladder until after the scan. Wear comfortable two-piece clothing. You'll likely lift your shirt and lower your waistband. How to prepare for a transvaginal ultrasound. This one might sound a bit more intimidating, but it's typically quick and painless. A thin, wand-like probe, with a protective cover and lubricant, is gently inserted into the vaginal canal. It gives clearer images, especially of the uterus and ovaries. How to prep. You do not need a full bladder. In fact, you may be asked to empty it. You may be given a gown or sheet for privacy. Let the technician know if you're feeling nervous. You're allowed to ask questions or take a moment to breathe. Remember, this procedure is often done during the first half of your menstrual cycle, especially for fertility evaluations. What to expect during the ultrasound. You'll lie on a comfortable exam table. The technician, often a woman, will explain what's happening before they begin. During a transabdominal scan, a cool gel is placed on your lower abdomen. The probe glides across your skin. You might feel pressure, but not pain. During a transvaginal scan, you insert the probe yourself, in many clinics, or the tech does it gently. You'll feel some pressure, but it shouldn't be painful. It usually lasts just 5 to 10 minutes. You'll see your organs on a screen. And yes, sometimes the tech will show you the images if you ask. After the ultrasound, what happens next? You can go back to your normal activities right away. There's no downtime and no recovery period. Results are usually sent to your doctor within a few days. If it was part of a fertility check or ongoing concern, your doctor may discuss follow-up tests or treatment options. Final checklist before your appointment. Know whether your bladder should be full or empty. Wear two-piece loose clothing. Ask questions and advocate for your comfort. Bring a list of symptoms or questions if it's part of a diagnostic check. You deserve to feel informed, calm, and confident going into your pelvic ultrasound. If this helped you feel more prepared, give this video a like, subscribe, and share it with someone who needs it. We'll learn in our next video about teratogens in pregnancy. What drugs can harm a developing baby? Stay informed. Stay focused. Thanks for watching.